the first one, 8 most disruptive issues in healthcare. Number 1, presidential healthcare policy. So what would you tell your peers about that?
Well, I'd say that's probably my least favorite of the group. But I'd say that this is an area where I often say, we just don't want to get too hung up in what's going on in Washington or what's going on with the administration. We have to pay attention to it. And I think the one message I'd say is that we're always going to be under some kind of influence from the government. And the more you can make your organizations more data-driven, more nimble, the better you're going to be able to adapt to whatever goes on in DC or at the state legislature. And don't get too hung up on the details or the specifics of it, because that changes constantly. Yeah. But you got to just be prepared to have information to be able to make some decisions and change. And I think it really speaks to just let's become more data intensive and data driven. I agree, and it's the one I like the least, and it's the one that I think has the least impact. The one thing I will say about this is I think with this administration, they're rolling back regulations, so. Right. We actually have a breather. If I'm talking to my CIO peers, I know the 8 years or so that I was sitting in the CIO chair, I mean, every year there was millions of dollars going towards regulatory compliance. And I think we have a reprieve, which we were asking for every year I was there to say, can we spend some money over here on innovation instead of compliance. So yeah, I agree. It has been a bit of a reprieve, and actually seeing some stuff being rolled back instead of continuing to add on.
Yeah. So and that ebbs and flows. Well, it'll come back eventually.